They say the early bird catches the worm, but in breast cancer, early detection saves lives. Today I'm here with Kerry Edghill, a mammographer, helping women take charge of their health through awareness and action. Hi Kerry, how are you today?
Hi.
I know you're a bit nervous, but we're just going to have a nice conversation and we are going to encourage women, educate women on a topic that a lot of them find daunting.
Yes,
I mean, I'm not at the age yet. However, we're going to go into what mammography is, what they should expect. But before that, tell me, what brought you to this field of radiography, mammography, doing sonograms? To me, it's quite interesting. I dabble a bit, in the form of my obstetric profession, but what led you to your profession?
I am actually a national under 21 hockey player at the time, and I injured my knee. Had to have some x-rays done. So it required a visit to the radiology department.
Yes.
And there I met the nicest radiographer, Miss Henry, who was very, very interactive with me, made me comfortable, and she also introduced me to radiography, being my mother's friend, of course.
Yeah.
So at that point, I started investigating on the internet, and I found out that the program was being offered at COSTAT.
Okay.
At the time, it was an associate degree, and all you had to have was sciences, which I did at CXC level.
Yeah.
So this is how my journey started with radiography.
After a hockey injury, and guess what? We're right next to the hockey center. Yeah. For women, the thought of going to have a mammogram is very scary. I want you to pull the veil back on that for me and walk us through what we should expect when we're going to have a mammogram.
Right. It's fine that you'd say that because it's really true. It's a daunting process, especially with the word out there being that it's so painful and uncomfortable, and just the thought of having to compress your breasts, it scares women away from making that step towards screening. And so it really is things like these that bring awareness to the fact that early diagnosis saves lives.
Yeah.
Right? And I know this because I'm a breast cancer survivor, and early diagnosis saved my life.
Yes.
And it was very effective in making sure that I'm at the stage where I am today, able to help others get to that point. So yes, mammography, it is scary, and you are nervous as a woman entering into the unknown, worrying about what might be found. But the reality is we want to catch it first, right?
Early.
So yes, we do compression, but compression is regulated. It's only for a few seconds.
Okay.
And modern equipment is making it a little bit more comfortable, because like earlier on, they used to have the plates wouldn't be as comfortable as they are today. And so I am pressuring you. Go out there and get your mammogram.
So
Yes.
when I walk into the room, if I'm going to have my mammogram, I'm going to see a standing machine
Yes.
with two plates. Walk me through it, what I'm going to see when I get into the room.
Right. So you see the mammogram machine. It is an arching machine.
Okay.
So it forms like this, and there are different size plates. So it depends on the size of the woman's breast.
Okay.
Those plates are interchangeable, and you will see the compression pad, but it's only going to come down when positioning starts to happen.
Okay.
So the mammographer will explain to you the positions that you need to stay in, and would explain to you how long you're going to be in that position for. Ideally, it would feel tight and uncomfortable, but it should not be painful.
Are we pressing the breast down to flat?
No, we are not. No, I know that's a preconceived idea of most, that it's going to be like a pancake, but no, it's not. There is actually a standard compression level for different types of breasts, different sizes of breasts. And so no, it's not going to go down to flat. And on that topic, we know that some persons' breasts contain fatty tissue
Right.
and some persons' breasts are dense. So the dense breasts will be harder to compress, and so they would have to have additional imaging like ultrasound,
Ultrasound.
as
Yes.
opposed to trying to compress the dense breast. So I know some ladies may say, but my breast is lumpy, you can't compress that. And yes, it's true, we won't try to do it.
And that takes us into the myths, you know, what women go about telling each other
Right.
about what to expect. Your breast too small, your breast too big. What are some of the myths, some comical, that you encounter as you're dealing with patients?
Right. So I actually, as you said that, I actually had patients say, my breast too small, I don't need a mammogram. Or my breast too big, the machine can't image me. The reality is the mammogram machine can effectively measure everybody.
Okay.
Because we have different size plates and it can be adapted for different heights, different sizes. The patient who is in the wheelchair can have a
Yeah.
mammogram done.
Yeah.
Right? We are trained to do that, to be positioning persons who be on wheelchairs, patients who have limitations.
Yes.
So, no, there's no reason to shy away from having the mammogram done. Right? Other myths is radiation may damage the breast.
Okay. Or cause
Right.
cancer.
Or cause cancer.
I've heard that one.
Right. And mammogram uses low dose radiation. The amount of radiation that you use to a mammogram is like background radiation for a couple of days, walking at 12 o'clock sun,
Okay.
or maybe taking a flight. That sort of radiation that you get is equivalent to what you'd get in a mammogram.
Okay.
So, you know, there's no fear of the amount of radiation that you get because the dose is so low that
Yes.
it really cannot cause anything to happen. And ideally, the other precaution is that's why you talk about age limit. We really don't tend not to mammogram, have patients who are younger than 40 do mammograms
mammograms.
because of cell division and we don't want to expose it to any type of radiation.
Okay.
Right? So because we are really trying to be proactive and not causing any harm
Right.
to patients, right? The other thing is that some people think that the compression may burst their breast.
No way. Burst the
Yes, I've heard that. Oh, that compression is gonna blow my breast into two. That's not happening. That's not happening. That
Okay,
is
so-
a myth.
In a nutshell, mammography is safe and we need to do it if we are at the age that we should.
Correct.
Tell me, where does imaging fit into the whole picture of breast cancer care? Is it only before or do we use it after as well? Give me a little insight into that.
Or mammogram and imaging go hand in hand with breast cancer and screening.
Okay.
So it is a before all the time, and I'm with you going down the road
Right.
wherever you go.
Yes.
As long as you reach the age, I'm going to be with you
Right.
doing your imaging. Every year we're going to be screening, and God forbid we find something, then the mammogram is used to guide location, size, what monitoring, if you need or require further treatment in terms of biopsies
Yes.
to find out what type of diagnosis this would be, and after treatment and during treatment for surveillance and monitoring.
Okay.
So we are here forever.
Forever. So that means then that you develop lifetime relationships with some of your patients.
Correct.
And the key parts in that which is unique to you is that you were a patient as well. How has that impacted how you care for your patients?
But being a patient myself, I am now better able to understand the uncertainty
Yeah.
and vulnerability in that moment. In that moment when you come in or preparing to come for your first screening procedure and you don't know what to expect, I know what it feels like. I also know what it feels like to have a positive diagnosis and going through that process of, is the mass getting bigger? Has it spread?
Yeah.
What we're doing, how long the next procedure is going to be. And after that, the surveillance of checking to see, has it come back? Is there reoccurrence? Did it spread to the other breast? So I'm very aware of what it feels like. And as a result, I'm able now to calm the anxiety,
Yeah.
listen to the patient,
Listen.
provide the comfort and support because I know from my perspective what it is and how it feels like.
To go
So I can,
through.
yeah, so I can genuinely tell them I've been there. I'm here with you.
Yes.
We're getting through this together.
Thank you so much, Kerry, for
You're
telling us and giving us your story, both on a professional and personal level. Thank you so much.
You're welcome. It's been a pleasure sitting with you.
Kerry reminds us that the bravest step is the first one, choosing to know, to check, and to act. Because when awareness turns into action, life-changing conversations happen in the open.